Good afternoon, everybody, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and the Honourable Dominic Cardy, Minister of Education and Early Childhood Development. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-parole aujourd'hui sont la médecin hygiéniste en chef, la Dr. Jennifer Russell, et le ministre de l'Éducation et du Développement de la Petite Enfance, l'Honorable Dominic Cardy. Dr. Russell.
Thank you, Bruce. Merci, Bruce. Good afternoon, everyone. Bonjour à toutes et à tous. Aujourd'hui, je discuterai le statut des éclosions de COVID-19 en cours dans l'ensemble du Nouveau-Brunswick, y compris ceux dans plusieurs établissements résidentiels pour adultes, de l'importance de respecter les directives et les consignes de santé publique, ainsi que des progrès réalisés dans le cadre de la campagne d'immunisation. Cette nouvelle vague de la pandémie de COVID-19 s'avère plus difficile que ceux que nous avons dû affronter jusqu'à présent. Today, I will be reporting on the status of the current outbreaks of COVID-19 across New Brunswick, including those in several adult residential facilities, the importance of adhering to public health guidance and advice, and progress on our vaccination campaign. This new wave of COVID-19 is proving to be more challenging than any we have experienced to date. In the first wave, we saw limited outbreaks in 1 or 2 regions at a time. Now we have numerous cases reported in 5 of our 7 health zones. No corner of our province has been left untouched. We are seeing multiple outbreaks in nursing homes and adult residential facilities in several communities, putting new stress on residents, staff, families, and caregivers. There have been confirmed cases in several schools, as Minister Cardy will report on during this briefing. Pour la 8e journée de suite, le nombre de nouveaux cas de COVID-19 que nous annoncerons aujourd'hui sera plus élevé que 10. Nous atteignons aujourd'hui que le cas des 800 cas confirmés depuis le début de la pandémie. Plus de 1600 citoyens du Nouveau-Brunswick sont présentement en isolement après être entrés en contact avec un cas confirmé de COVID-19. Cette situation vient bouleverser comme jamais leur vie ainsi que leur collectivité. For the 8th consecutive day, we will be reporting double-digit increase in new cases. We have today reached 800 confirmed cases since the start of the pandemic. More than 1,700 New Brunswickers are now in self-isolation after coming into contact with a confirmed case of COVID-19. This represents an unprecedented disruption in their lives as well as the communities in which they live. And all this is happening as we accelerate our efforts to vaccinate those at highest risk from COVID-19. Now, more than ever, it is absolutely vital that every New Brunswicker follows public health guidance and advice so that we can slow the further spread of this disease. Chaque région de la province se trouve présentement à la phase d'alerte orange. Vous devez donc porter un masque en public tant à l'intérieur qu'à l'extérieur. Vous devez également vous maintenir à une distance d'au moins 2 mètres des autres en tout temps. Vous devez aussi ne pas aller au travail ou à l'école si vous ne vous sentez pas bien. Restez à la maison. Si vous ressentez des symptômes de la COVID-19 aussi insignifiants qu'ils puissent paraître, restez à l'écart des autres et prenez les mesures requises pour subir un test de dépistage dès que possible. C'est très important de vous faire tester. As every region in the province is at the orange alert level, this means wearing a mask when you are out in public, both indoors and outdoors. It means maintaining 2 meters of physical distance from others at all times. It means staying home from work or school when you don't feel well. If you are experiencing any symptoms of COVID-19, no matter how trivial they may seem to you, please stay away from others and arrange for testing as soon as possible. It is very important that each and every individual who has symptoms get tested. If you have not already done so, please download the COVID Alert app to your phone. This will greatly assist in our contact tracing teams to swiftly identify contacts and get them into isolation. It's critical that all New Brunswickers download the app. If we do all of these things, we will be improving our chances of slowing the pace of this outbreak and putting our province back into the path of recovery. It also will protect us against future outbreaks, as well as the risks of the UK variant entering our province and taking hold here. Today, there are 21 new confirmed cases of COVID-19 in the province. The new cases are as follows. In Zone 1, which is the Moncton and Southeast New Brunswick area, there are 4 new cases. In Zone 3, which is the Fredericton and St. John River Valley, 7 new cases. In Zone 4, which is the Edmundston Grand Falls area, 6 new cases. In Zone 5, which is the Campbellton-Restigouche region, 4 new cases. There are now 204 active cases of COVID-19 across the province, more than we have seen at any time since the pandemic began last March. There is 1 person in the hospital at this time, and I ask that you direct your thoughts and prayers to everyone now being impacted by this pandemic in every corner of our province. Aujourd'hui, j'annonce qu'il y a 21 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. Les cas se répartissent comme suit. Il y a 4 cas de la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. Dans la zone 3, soit la région de Fredericton et de la vallée de la rivière Saint-Jean, il y a 7 nouveaux cas. Il y a 6 nouveaux cas dans la zone 4, soit la région d'Edmundston et de Ganseau. Il y a 4 nouveaux cas dans la zone 5, soit la région de Campbellton-Restigouche. Il y a présentement 204 cas de COVID-19 dans l'ensemble de la province, soit plus que jamais depuis le début de la pandémie en mars dernier. Une personne ayant contracté la COVID-19 est présentement hospitalisée. We have also confirmed outbreaks in 3 adult residential facilities whose residents are particularly vulnerable to the COVID-19 virus. I am pleased to report that there are no new confirmed cases at these homes in St. John, Riverview, Hillsborough, and Baker Brook. Our prompt teams are working with staff in each of these facilities to manage care and slow the spread of infection, and they are doing an excellent job. So I'm really, really proud of the work that they're doing right now. A new round of testing for residents and staff at Parkland St. John will be taking place today. To date, 14 residents and 10 staff members have tested positive. Testing will take place tomorrow at Canterbury Hall in Riverview and Foyer St. Elizabeth in Baker Brook. At Funday Royal Manor in Hillsborough, where there have been 2 confirmed cases, there will be a further round of testing for residents and staff on Thursday. I can also inform you that a prompt team has been deployed to assist at Tobique First Nation. As shipments of approved COVID-19 vaccines arrive in the province, we are moving to inoculate New Brunswickers. This is a very slow process because there is such a limited supply of vaccines right now, but there will be a bigger supply over the course of the next several months. We are beginning with most vulnerable to this disease, residents of long-term care facilities and frontline healthcare workers. As the supply increases in the weeks and months ahead, the vaccine will become available to all New Brunswickers. Dès que les lots de vaccins approuvés contre le COVID-19 arrivent au Nouveau-Brunswick, nous les administrons aux citoyens de la province afin de les immuniser. Nous donnons le vaccin en premier aux personnes les plus vulnérables à cette maladie, soit les résidents des établissements de soins de longue durée et les travailleurs de la santé de première ligne. Au fur et à mesure que les stocks de vaccins augmenteront au cours des semaines et des mois à venir, il sera possible d'immuniser tous les citoyens du Nouveau-Brunswick. Please be assured we are working as hard as we can to get everyone protected. We have improved our capacity to deliver vaccines that require ultra-cold storage with the delivery of new freezer units to regional hospitals in several zones. To highlight our vaccination effort, we are adding numbers to the New Brunswick COVID-19 dashboard, which is available online, and we will be updating these numbers weekly. We do know that people have a lot of questions about the vaccination program. Whether you're a layperson, whether you're somebody in the public, whether you're a healthcare worker, our website has an excellent frequently asked questions document. Please read this document. It's very, very helpful. There is also an email address where if you have further questions, you can email us and ask your questions. To date, we administered a total number of 7,732 doses. The remaining 3,443 doses which we have received will ensure we can provide the second injection, the booster dose, to those that were immunized in our first clinics. Pour illustrer nos efforts en matière d'immunisation, nous ajouterons des données au tableau de bord sur le COVID-19 au Nouveau-Brunswick. Ce tableau est disponible en ligne. Nous mettrons ces chiffres à jour chaque semaine. Il y a aussi beaucoup d'informations sur le site Web, sur les vaccins, le programme de vaccination, comment ça déroule, etc. Beaucoup d'informations. Si vous avez des questions, il y a une adresse de courriel que vous pouvez envoyer vos questions aussi. On sait que les gens ont plusieurs questions et on essaie de les adresser. Jusqu'à présent, nous avons administré en tout 7 732 doses de vaccins. Nous avons mis en réserve 3 443 doses reçues du vaccin afin que nous puissions donner une deuxième dose à ceux qui ont déjà reçu leur première. This week, we will be conducting vaccination clinics in Hamilton, Edmundston, Fredericton, and St. John, focusing on our priority groups. But if we are to protect the vulnerable and those at the front lines, we must also protect our vaccination effort. We must ensure that those who are giving the vaccines remain healthy. We must make sure that the healthcare workers are able to get the vaccine as soon as it becomes available for them. To keep us healthy, we need to keep them healthy. Lorsque vous respectez les consignes et les directives de santé publique, vous vous protégez vous-même et vous protégez les membres de notre famille contre la maladie très grave. Vous préservez aussi notre capacité à faire progresser notre campagne d'immunisation et contribuer de même coup aux efforts visant à mettre à fin cette pandémie. Le déroulement va prendre au moins 6 à 9 mois, alors il faut patienter. Et aussi, on veut juste remercier tous les traceurs de contact étroit. Maintenant, ils travaillent très, très, très fort. Et si vous les parlez au téléphone, dites-leur merci. When you follow public health guidance and advice, you are protecting yourselves and your families against this very serious disease, as well as the potential for the UK variant to take hold here in New Brunswick. So all of our efforts are around keeping COVID-19 out of New Brunswick and keeping it from spreading once it gets here. You are also protecting our ability to move forward with our vaccination campaign, which will help bring this pandemic to an end. I am profoundly grateful for all the efforts that New Brunswickers are making to help slow the spread of COVID-19. Your actions are truly heroic because lives are being saved. Please keep doing what you have been doing. Please, with kindness, with empathy, encourage your family, friends, and neighbors to follow your example. We can all get through this. If we get through this, we must work together, and that is what we have been doing thus far. Avec gentillesse et empathie, encouragez les membres de votre famille, vos amis et vos voisins à suivre votre exemple. Nous réussirons tous à traverser cette épreuve si nous travaillons ensemble. Merci beaucoup. Thank you.
Good afternoon, everyone. Bon après-midi, bienvenue. So, as has been already reported, we've had a number of positive cases of COVID-19 impacting schools in zones 3 and 5, which were confirmed over the course of the weekend. In addition to the confirmed case at Besborough School in Moncton announced last week, positive cases of COVID-19 have been confirmed at Woodstock High School and Townsview High School, or school rather, in Woodstock, Académie Notre-Dame and École aux 80 in Dalhousie, and the polyvalente Roland Pépin in Campbellton. So, une cas positive de COVID-19 a également été confirmé vendredi dernier à la garderie Tic-Tac-Toe située dans l'école Académie Notre-Dame à Dalhousie. Au cours de la dernière semaine, des cas positifs à la COVID-19 ont été enregistrés dans 6 centres de la petite enfance. Je tiens à remercier les exploitants et les éducatrices pour leur collaboration remarquable et leurs interventions rapides. C'est grandement apprécié. Vous avez toutes et tous montré une grande force de caractère malgré la pression. Je suis fier de constater que nous pouvons compter sur les gens de Nouveau-Brunswick aussi remarquables qui ont vraiment à cœur la santé et la sécurité des plus jeunes apprenants dans notre province. I'd also like to take this opportunity to remind families that if there is a confirmed positive case or possible exposure to COVID-19 in a school or in a child care facility, families and the school community will be notified directly. And otherwise, for folks outside of those groups, no news is good news. So we're committed to keeping you as informed and up to date with information as soon as it becomes available, but we're also going to do our best to continue to protect the privacy of staff and students as required by the Personal Health Information Privacy and Access Act. So for today, students at Académie Notre-Dame, École aux 80, Woodstock High School, and Townsview School will be staying home for an operational response day. That means getting the school cleaned up, getting things ready if we do have to go for online learning, taking those necessary steps. But for tomorrow, January 12th, students at Woodstock High and Townsview School will begin learning online for the rest of this week. So les élèves de l'école aux 80 vont aussi être en mode virtuel, mais de retour en classe à compter du 25 janvier, à moins d'avis contraire. La majorité des élèves de l'Académie Notre-Dame seront de retour en classe à partir de demain, avec quelques classes en mode virtuel. Des communications se poursuivant directement des écoles à la communauté, des parents et des familles devraient être prêts que la situation pourrait évoluer dans les prochains jours, dépendant de la disponibilité des enseignants suppléants. Les élèves de 9e, 11e et 12e année de la polyvalente Roland Pépin sont retournés à l'école comme d'habitude aujourd'hui, tandis que les élèves de 10e année apprennent en mode virtuel. So at Bessborough School, the majority of students returned to school today, while a handful of classes continued to be taught online. And I know this situation is stressful for families, and anxieties are high at a time when, as Dr. Russell has pointed out, we have cases across the province, and we are facing our most difficult moment since March, and I would argue perhaps even more difficult than that, as the virus is now not a faraway threat, but is all around us, submerging provinces and states and our frontiers, and we're seeing that leakage into our province. And everything that we can do to push it back, we're going to continue to try to do. But after months of COVID regulations, after months of restrictions, I get that people are tired and frustrated and a little bit fed up. And you layer in on top of that the justifiable fear that comes from having to deal with a deadly pandemic. And that just makes me all the more appreciative to be a New Brunswicker and to hear the stories that I hear every day from across the province, of people doing the right thing and making the right sacrifices to keep this deadly disease at bay. So I want to thank everyone again for their tolerance, their kindness, their patience, and the fact that they are keeping front of mind every day, the citizens of this province, the need to follow the directions from public health so we can get through this, these last few weeks before the vaccine rollout starts to pick up. So I know lots of folks have still got questions on how decisions are made on when to close schools or who moves to online learning. And those decisions are made using the comprehensive risk assessments by public health to ensure that our responses align with the associated triggers and alert levels, the color phases and so on that we've all become comfortable with. We also consider the operational requirements for keeping schools open. Do we have enough custodians? Do we have enough bus drivers, teachers? Those are the normal sort of operational concerns that guide the school's decisions every day on whether or not they can open or not. Sometimes in the past, flu outbreaks have caused schools to have to consider closing temporarily. So this isn't exceptional or unusual, but it's still an enormous headache. So we have to look at, well, as how the transition to online learning can cause additional problems itself. Because blended learning has absolutely made it easier for high school students to continue home learning for a few weeks if necessary, and why government put in place the measures to do as best as possible, connect all high school students with a device and with an internet connection that allow them to work online. This weekend, for example, while contact tracing was carried out in the Woodstock area, we ended up with roughly 1,400 staff and students who were asked to isolate for 48 hours as a result of those 4 cases in the Woodstock schools. So we absolutely, again, are ready if we have to move online, but we really want to try and avoid it whenever we can, because our plans are designed to keep our students safe. And one of the most inspiring things I've heard was when Dr. Russell said that if her kids had to go to school in Orange, she would have no problem sending them to school in Orange. And you can see that even in Orange, we're taking steps to close schools when we have to, for short or longer periods of time. Because as long as I'm minister, I can tell you we are not going to hesitate from listening to the advice of public health and taking the right steps to protect our staff and our students. But that, as much as possible, means keeping schools open, not closing them down. So, talking about all those people in Woodstock, over 1,000 folks involved in the school system, having to isolate over a weekend when the schools aren't even open. I want to thank them for their compliance, which is a dry kind of word, but it basically means they're stepping up as citizens, doing the right thing even though it's inconvenient, even though it's difficult. They help the contact tracers, and I'd reiterate Dr. Russell's call to be kind to the contact tracers if you have the opportunity to talk to them directly. And I'll repeat something I believe I've said from this podium before. If there is a group of people in this province to whom we all owe an enormous debt of gratitude, it's the contact tracers who have ferreted out and run down cases of COVID-19 across New Brunswick from the beginning of this pandemic. And every time when I've woken up during the course of this outbreak and wondered every day whether this would be the day when we'd see broad community transmission of COVID-19, and then finding that no, the contact tracers did their job, that they got things back under control. It's an incredible testament to their hard work and dedication and to the honesty and participation of New Brunswickers. So again, we knew from the outset that this situation was going to be causing significant operational impacts on both of those schools in Woodstock. That's why we made that decision to move those students to home learning just for the next week. Alors, nous avons toujours dit que nous n'hésiterons pas à avoir recours au apprentissage à domicile quand c'est nécessaire. Ces décisions doivent toutefois être bien réfléchies. N'oublions pas, le mandat principal du ministre de l'Éducation et du Développement de la petite enfance est de s'assurer que chaque élève ait accès à une éducation de première qualité. Il faut offrir aux élèves des milieux d'apprentissage sains et sécuritaires pour favoriser au maximum leur réussite scolaire. C'est pourquoi nous avons mis en place des plans pour faire en sorte que les écoles publiques puissent demeurer ouvertes, même s'il n'y a qu'un petit nombre de cas signalés. But we need the cooperation of New Brunswickers to ensure that students can continue to attend school and to access the programs and supports that are offered through the education system. Programs that can be as basic as making sure that students have food in their stomach to be able to get through the day. The mental health supports that many students require. The social engagement that all humans need to be able to get through their days and weeks. We can only do that if everyone helps Dr. Russell, me, and the rest of the team keep our schools open. And that's why it's critical that New Brunswickers continue to wear their mask, meet virtually whenever possible, keep your distance, wash your hands, and generally follow the advice of public health. Listen to Dr. Russell. Over the course of the weekend, I heard from someone I'm close to that her son decided that the best response to the province going orange was to drive to St. John from Fredericton for the express purpose of buying chicken. She said, and this is a woman who's recently come through surgery, she said, like, what are you doing? How could you be putting people at risk? And apparently responded, LOL. Meanwhile, someone else I'm close to has been following the rules for self-isolation and more, and has hardly seen anyone for weeks and weeks, a situation that so many people living alone in this province have had to endure over recent months. And it's those people in that second category, and I know because she asked me, she said, it's kind of hard to sit here at home alone when you know that some people are really choosing to do the wrong thing for the wrong reasons. So I want to make it really clear that when Dr. Russell stands up here, or I do, or anyone else from government, and we make these pleas for people to wear their masks, we know that nearly everyone is listening. We know that nearly everyone is paying attention, and we know that's why New Brunswick is doing so well in combating this pandemic. But for those few out there who refuse to take this seriously, open your eyes, turn on the news. Look at the emergency rooms being overwhelmed across this continent and around the world. Imagine if it was people you cared about being in that situation. Don't do it. Don't make a decision now that you're going to regret for the rest of your life. A selfish, tiny day-to-day decision like going to a restaurant in another health zone. Come on. We are better than this. But when I say that message with that tone, that is directed at the tiny minority of people who are refusing to listen to the advice that's put us in a position that is still enviable in comparison to the rest of the world. There are so many layers of protection, as Dr. Russell has talked about regularly, but they're only effective when they're all used together. Il faut donc continuer d'agir comme si le COVID-19 pourrait survenir n'importe où. Il faut continuer d'être super vigilant. Les précautions et les mesures sanitaires que nous prenons servent autant à nous protéger nous-mêmes qu'à protéger les autres. Comme vous le savez, la situation peut évoluer rapidement chaque jour. Nous demandons donc aux familles de continuer d'être vigilantes, de bien se renseigner en surveillant les courriels et leurs téléphones pour toute mise à jour sur la situation. So before we begin to take questions, I'd like to remind parents and students of a couple of new services that are available to them. IT support. It's available for students and staff who experience any connectivity issues related to online learning. So I'd ask folks who are listening, pay attention to these numbers and this info, because it might not be your school, students in your family who are affected by this today, but it could be tomorrow or next week. Help is available through the Bell call center at 1-833-453-1140. 1-833-453-1140. More information on these services have been sent home through your schools. Virtual counseling sessions and a variety of other wellness and mental health services are available directly through our schools. We're committed to continuing the hard work of keeping our schools open so students can keep learning, growing, and engaging with each other in a healthy and safe environment. And again, want to thank everyone in the schools, the districts, and the department for all their collaboration over the past few days. And again, to thank Public Health and those contact tracers for their incredible work and their support in keeping all New Brunswickers safe. Au cours des derniers mois, nous avons acquis beaucoup d'expérience à gérer les cas dans les écoles. Je suis convaincu qu'en ayant votre collaboration et grâce à votre entraide et à votre bonne volonté, nous parviendrons à surmonter ces défis rapidement et de manière sécuritaire. Our plans worked when it's had contact with the virus so far. Let's keep it up. The plan is only as good as those of us who are willing to follow it. So let's keep working together. As Dr. Russell said, we're almost there. Let's do it. Thank you.
Merci beaucoup, Monsieur le ministre Cardy et Dr. Russell. Thank you, Dr. Russell and Mr. Cardy. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Voulez-vous assurer de désactiver le son de vos micros, s'il vous plaît? Chaque journaliste aura une question et un suivi. We'll now proceed to questions from members of the media. You have the right to pose your question in the language of your choice. Please ensure your microphones are placed on mute, and each reporter will have one question and a quick follow-up. Silas Brown, Global TV.
Hi, Dr. Russell. You mentioned that it's critical that more New Brunswickers download the COVID Alert app. I'm curious what public health is seeing in terms of uptake and how low that uptake really is for the app at this point.
The last number I had was that we were around 9% compared to other provinces, but again, we really don't have a great breakdown of that just because they release the information for the entire country. But it would be helpful if people did download it now. Again, during these outbreaks would be very, very helpful, but it also would be helpful for future outbreaks. And certainly if the UK variant were introduced here, the rate that would be transmitted would be so great that, so high rather, that the COVID-19 app would be very, very, very crucial in helping us contain it.
Mr. Brown, do you have a follow-up?
Yes, I'm curious about how contact tracing is going right now. Is contact tracing overwhelmed? Are people being able to be reached in a timely fashion? Can we get an update on how that's going?
My understanding is it's going well. They knew they were going to have challenges with the schools in the Woodstock area over the weekend, so that's why they had asked everybody to self-isolate during that time so that they could make sure that if it was going to take up to 48 hours, then all of those people would be self-isolating during that time. So that was very, very helpful. So they were able to get through the entire list of the students. There were about 1,400 people that they had to contact. So again, that worked very well to have everybody stay in place while that was happening and self-isolate. Yeah, my understanding is it's going well. Our team is working so hard. I mean, I was at the NBHOC, the Health Emergency Operations Center this weekend, and the staff there, you know, lots of energy, lots of enthusiasm to keep going. Everybody's working hard to protect New Brunswickers right now, and a lot of New Brunswickers are doing the same. So I want to thank everybody for their hard work.
Thank you, Doctor. Thank you, Mr. Brown. Marie Sutherland, CBC.
Hi, my question is for Minister Cardy. The Atlantic Education International Program is soon going to be receiving foreign students who will be billeted with families and enrolled in schools around the province. Can you tell us how many students are coming into New Brunswick through this program this week and what it will take to accommodate their isolation for 14 days?
Sure, thanks. I don't have those numbers here with me, but happy to get them as soon as possible after the press conference is done. Je n'ai pas les nombres exacts sur le nombre d'étudiants internationaux qui arrivent à partir du programme du AEI et on n'a pas les détails avec moi ce moment, mais on va les fournir après la conférence de presse.
Sutherland, do you have a follow-up?
I do, but first on this one, if we may not have the exact numbers of students, but we probably do have plans for accommodating their isolation. I'm just wondering what that is.
Again, so the AEI is, happily make sure you get all those details. AEI is a sort of quasi-independent organization who handles dealing with those questions, but we'll happily make sure that we get all that information back to you as quickly as possible.
Follow-up?
Okay, thank you. My follow-up's for Dr. Russell. How many healthcare workers are off today for COVID-related reasons? And with cases continuing to rise, what's the plan to cover staffing as hospitals start to become overwhelmed?
So the good news is that Vitality and Horizon monitor this information on a daily basis. So combined Vitality and Horizon numbers are around 85 healthcare workers are self-isolating at home right now for COVID-related reasons. They have quite a robust plan actually in terms of how to do the reassignment and redeployment of staff. So again, that's monitored on a daily basis as well to make sure that if there are people that need to be redeployed to other areas that are critical, then they can do that. So so far that's been working very well. And again, that the healthcare workers, that number of 85 also includes the extramural and ambulance New Brunswick staff as well.
Thank you, Ms. Sutherland. Vicky Hogarth, CHCO TV.
Thank you, Bruce. Dr. Russell, can you please give us an update on the Pfizer vaccine clinic this past weekend? How many New Brunswickers received their second dose of the vaccine and are now fully vaccinated? And what was the feedback from that clinic?
I'll start with the feedback. What we know about the second dose of the Pfizer vaccine is that if anybody's going to have a reaction, usually it's to the second dose, the booster dose, as opposed to the first dose. So I think with the first doses, we just saw a regular kind of sore arm. I think this time we were seeing a bit more of the effects of the fatigue and aches and stuff like that. But in terms of the numbers, I think I read it in my speech. I feel like I had those numbers in terms of how many. So 1,862 people have received both doses of the Pfizer vaccine at this point in time.
Do you have a follow-up, Ms. Hogarth?
I do, for Dr. Russell. Dr. Russell, I'm wondering, how does public health monitor for the presence of the UK strain and the South African strain of the virus? And is there evidence to suggest that the two vaccines currently approved protect against these strains?
So the conversations are ongoing at the national level around the variants. So the Special Advisory Committee and Public Health Agency of Canada and Health Canada are in conversations with the manufacturers about that. Pfizer has said that they could, that right now the UK variant will be covered by the current vaccine, but if there were other variants, such as the African variant, that they could redesign the vaccine to cover that one as well in about 6 weeks. So that's the information that we have and we've been talking about at the national level. In terms of monitoring in this province, we do have criteria in terms of sending the samples of somebody who's tested positive for COVID-19 to the National Microbiology Laboratory in Winnipeg to help us do that identification of the UK strain. We so far have sent two samples out there of people who had traveled from the UK and tested positive for COVID, but they came back negative. The turnaround time is about a week. So we'll continue to send samples out there as need be, and we'll continue to monitor the transmission rates and attack rates of any of the outbreaks that we see here that show anything like a variant effect.
Thank you.
Thank you. Rose Saint-Pierre, Radio-Canada.
Oui, merci Bruce. Ma question est pour le ministre de l'Éducation, Dominic Cardy. Quel bilan on peut faire de la session d'automne au Nouveau-Brunswick? Est-ce qu'il y a des retards pour les élèves?
Merci pour la question. Je peux comprendre pour l'année scolaire qui commence en septembre 2021?
Tu clarifies?
Oui, donc
OK.
pour la session d'automne de septembre à décembre, là, quel bilan on peut tirer? Est-ce qu'il y a des retards?
OK, de 2020. OK, sur les,
Au niveau des apprentissages, oui, 2020.
On n'a pas encore les analyses sur ça parce qu'ils sont encore en plein processus de gérer cette année. Comme j'ai dit, sur quelques autres dossiers liés à faire la collection d'informations, de données sur qu'est-ce qui arrive dans les écoles, on va attendre qu'au fin de pandémie pour faire ça. Aujourd'hui, notre tâche primaire est d'assurer la continuation du système scolaire dans une manière sécuritaire, efficace et qui livre aussi une éducation d'autre qualité pour les enfants. Alors, je suis hâte de voir l'information qu'on va voir, l'impact du COVID-19 sur la réussite des élèves partout dans la province. Et je suis certain que ça ne va pas être positif. Mais encore, je ne veux pas ajouter du stress au système aujourd'hui, un système qui est déjà sur beaucoup de stress juste pour continuer les opérations à peu près normales.
Mademoiselle Saint-Pierre, tu es suivie?
Oui, toujours pour M. Cardy. Comment est-ce qu'on peut expliquer que si les enfants sont dans des bulles classes, isolées, parfois il faut que toute l'école soit en quarantaine quand on a des éclosions et non pas seulement certaines classes?
Okay. Merci pour ça. C'est à cause du fait que si on entend de santé publique qu'il y a un niveau d'inquiétude que le problème autour d'une éclosion dans une école, dans une communauté peut agrandir, c'est nécessaire d'élargir notre réponse d'une classe à l'école en grand. Ou même quand j'ai mentionné aujourd'hui, des fois ça va être une seule année, parce qu'une des écoles secondaires, c'est les élèves de 10e année qui ne sont pas à l'école aujourd'hui, mais 9e, 11e, 12e ont retourné aux classes. Just answer that very quickly in English for folks who are interested, that the reason why we usually move towards closing down a whole school rather than just one class, if there's been an impact there, is on the advice of public safety or public health. If it's seen that there's more of a concern that we have a case or cases that could be more easily spread, if the risk is there, that's when we close the schools down. And on impacts on learning from last year, the short answer there is we're not looking at collecting that information and analyzing it right now. We're getting through this year. Once COVID-19 is behind us, we'll get that information, make that analysis, and make sure we roll it into our plans for getting school back to a real normal after COVID, hopefully for September 2021.
Merci. Meg Cunningham, CHMA News.
Thank you, Bruce. My question is for Dr. Russell. Now that there are fines for incomplete or false information given to contact tracers, does this mean that those who are undergoing interviews have immunity from potentially incriminating themselves during those interviews?
All I heard was about people not giving correct information.
Slow it down. Can you repeat it again, Meg?
Yeah, sorry about that. Can you hear me okay now?
Perfectly.
Okay, thank you. Now that there are fines for incomplete or false information given to contact tracers, does this mean that those who are undergoing interviews have immunity from potentially incriminating themselves during those interviews?
Well, if they're not providing accurate information, they would be susceptible to receiving fines if it is found out that they're not giving correct information on purpose, deliberately.
Ms. Cunningham, do you have a follow-up?
I'm more so talking about people who may be engaging in illegal activity. If they disclose that to a contact tracer and they incriminate themselves during that call, can they be charged for that?
I wouldn't be able to speak to that. You'd have to probably talk to somebody from Department of Public Safety. But with respect to giving accurate information around COVID-19 and their whereabouts and the people that they've been in touch with, in contact with, these are life and death pieces of information that our contact tracers need to protect the public. So we take that part very seriously. Obviously, if there's criminal activity that's going on that is making them not want to disclose, it doesn't really matter the reason why they don't want to disclose. By not disclosing, they're putting people's lives at risk.
Thank you, Ms. Cunningham. Mathieu Roy Como, l'Acadie Nouvelle.
Dr. Russell, vous avez dit tout à l'heure qu'il y avait plus de 3000 doses mises en réserve pour donner une deuxième dose aux gens qui ont déjà été vaccinés. On sait qu'à un moment donné, les fabricants suggéraient de ne pas attendre et puis de donner toutes les doses tout de suite parce qu'il y aurait des deuxièmes doses suffisamment pour vacciner les gens. Pouvez-vous nous clarifier tout ça et nous expliquer pourquoi vous gardez des doses en réserve?
Une couple de raisons. Une raison, c'est vraiment, on demeure ici au Nouveau-Brunswick, on ne sait pas ce qui va arriver avec la température et les routes pour la livraison et même le voyage des gens qui vont venir pour le prendre. Alors, c'est vraiment juste quelque chose en sécurité pour qu'on sait que les gens peuvent l'avoir. Mais si c'était nécessaire, on lui donnerait, parce qu'on sait que la limite avec le Pfizer, c'est au moins 21 jours, mais ça peut être plus long que ça. Et aussi avec le Moderna, c'est 28 jours.
Je vois comment as-tu suivi?
Oui, j'aimerais savoir si vous avez des prédictions concernant le moment où tous les gens prioritaires, c'est-à-dire les résidents des foyers de soins et les travailleurs de la santé de première ligne seront vaccinés. Quel est notre échéancier au Nouveau-Brunswick pour ces deux catégories de gens-là prioritaires?
Alors, le déroulement de la campagne d'immunisation, ça se fait dans 3 phases. Puis la première phase, c'est exactement ça, les résidents de foyers de soins, les résidences de long terme, les travailleurs de santé et aussi les gens qui demeurent dans les autochtones adultes. Et c'est vraiment tout basé sur le nombre de doses qu'on va recevoir et on sait que à peu près dans les prochaines 12 semaines, on sait que on pourrait avoir toutes les doses qu'on a besoin pour vacciner cette population.
Je vois comment.
C'était mes 2 questions, Bruce.
Merci. Laura Lyle, CTV.
Hi there. My question is for Dr. Russell. Dr. Russell, have the residents of Tucker Hall at Parkland St. John been removed from the current round of vaccinations? And if they have, why?
Well, we've had multiple discussions and we're having more discussions today about what the risks are of having vaccination clinics held in places where there are outbreaks declared. So again, those discussions are ongoing, but the safest approach at this time was to not vaccinate people in a facility where there was an ongoing outbreak.
Ms. Lyle, do you have a follow-up?
I do. Is that due to our current supply of rapid tests? And what is our current supply of rapid tests?
Well, there's many things to take into consideration. It's not just about the testing, but just the fact that they're really focusing on cohorting, self-isolating, and there's already a number of staff that are deployed to just look after the outbreak. And again, it's really about logistics at this point in terms of just, again, trying to manage the resources as effectively as possible at this point in time. But again, the discussions are ongoing, and if it's decided that in future outbreak situations that we would consider immunizing people, then that's what we would do. But again, all the discussions that we've had with our regional medical officers of health and other members of our public health team, it just wasn't the right approach for this particular time.
Thank you. Andrew Watt, Brunswick News.
Yeah, hi, Dr. Russell. So I was having a look at the numbers from the Atlantic provinces since New Year's Eve. New Brunswick's had 200 new cases by my count. The next closest is Nova Scotia at 45, and PEI and Newfoundland and Labrador are in the low single digits. Why do you think it's so much worse here than in the rest of Atlantic Canada?
A few reasons. One, we are kind of the gatekeepers of the rest of the maritime provinces, at least anyway, in terms of people coming across the Quebec border, coming, anywhere from the rest of Canada, and then also the border with Maine. So we definitely have a lot of travelers coming into New Brunswick. We definitely had more travelers over the holiday season. We normally would have at any one time 4,000 to 5,000 people self-isolating as a result of being a non-essential traveler. Over the Christmas holiday period season, we saw that number go up to 8,000 people self-isolating as a result of non-essential travel. So that was a huge number of people added to our population who traveled and would have needed to self-isolate very safely to prevent any spread. We also know that the gathering time, the nature of that time frame is that there were people that were going to gather. And while we had set a number of 20 as the maximum to gather, we wanted that to be the same consistent 20 over the entire course of the holiday period, so that would facilitate contact tracing in the event of an outbreak. What happened was that we ended up having people going to gatherings as well as workplace settings who were symptomatic. So that list of 20 contacts that we wanted everybody to stick to only worked if people didn't attend any of those functions with symptoms. So the message from the gatherings and what we learned was that you can tell people to self-isolate safely. That may or may not always work. So we're trying to bolster that information around how to self-isolate safely. We're also aware that people had attended gatherings or workplace settings with symptoms. So we're trying to message that people need to get tested even if they have very mild symptoms. Because once these cases happen, they spread to multiple different settings and locations around the province. So we're really, really understanding what happened, and we're trying to message, again, how to prevent the ongoing transmission at this point in time. So the best thing people can do is to self-isolate right away, get tested right away when they have any type of mild symptoms that could be COVID-19 related.
Thank you, Dr. Mr. Waugh, do you have a follow-up today?
I do, thank you. Dr. Russell, what do the latest projections for New Brunswick show? I know that, in April, early April, when COVID was nowhere near as big a problem as it is right now, there was a projection of 15 deaths by the end of the month. What do the numbers say now?
Well, two things. One, at the national level, they are redoing all the modeling. And here in New Brunswick, we do constant modeling based on the actual outbreaks that we're experiencing, so that we can help understand what the worst case scenarios can be in whatever situation we're in, and help prepare and prevent that from happening. Which we have to date been quite successful at managing. So we're going to continue to use that approach, and hopefully, again, with all the measures that we have in place right now and all the communications messaging that we have right now, hopefully we can get things contained in the shortest amount of time possible with the least number of people being affected. Early in the pandemic, we had projections around 10% of cases would need hospitalization and 5% of those would need ICU admission. We've since looked at our data from every outbreak during the pandemic, and our numbers aren't quite exactly the same. They're not far off, but that's a ballpark projection of what we have been seeing. But again, it depends on the demographic of the outbreaks and the cases, because as you know, most of the people that were affected in the Zone 5 outbreak a few months ago were an older population, so that would then drive the numbers up in terms of people that would need hospitalization and ICU admissions. So we're keeping an eye on it. We talk with Vitality and Horizon every single day to monitor the situation. And again, with all that information in mind, we can, again, project out just based on some of the ballpark numbers to make sure that we're going in the right direction. But again, at the national level, there is more modeling happening. We probably will model what would happen with the new variant as well, because we've seen what's happening in the UK and that, over the course of 6 weeks, how quickly that variant spread throughout the entire country. So we're definitely keeping a close eye on what's happening elsewhere and keeping that in mind when we're looking at what we need to do here in New Brunswick to prevent the UK variant from getting in, as well as other variants, and what to do to prevent their transmission once they get here and make sure that we detect them as soon as possible.
Thank you, Mr. Waugh. Thank you, Dr. Savannah Odd.
Hi there. My question is for Dr. Russell. I'm wondering if you can tell me how many first doses of the COVID vaccine have been administered at long-term care homes in both staff and residents, and if either of those groups received the second dose as well.
As of right now, the number of people that I know have received the second dose is the number that I quoted not too long ago is about 1,862, but I don't have the breakdown of the residents versus healthcare workers. I could try to find that for you. I'm sure we have it. I just don't have it in front of me. Do you have another question?
Ms. Odd, do you have a follow-up?
Yeah, sure. So I'm wondering whether we've observed any evidence of student-to-student transmission or student-to-teacher transmission, or, teacher to student, in schools to date.
I don't have that information either. I know prior to these outbreaks, I'm pretty sure we hadn't seen that. And when we talk about transmission student to student or adult to student, we probably would be able to qualify that with the exposure setting, because sometimes, actually almost all the outbreaks, the exposures happened outside the school setting for the most part. And if there was any transmission, it was adult to child versus child to adult and child to child. But I don't have the latest information from these outbreaks, but I can track that down as well.
Thank you, Dr. David Caron, l'Acadie Nouvelle.
Oui, allô, ça va bien? Ma question s'adresse à la docteure Russell. Donc, encore une fois, il n'y a pas eu de cas dans les zones 6 et 7. Et donc, évidemment, on ne va pas s'en plaindre. On se sent chanceux qu'on a été relativement épargnés. Mais ça me semble quand même surprenant qu'il n'y ait rien. Donc, je me demande si la santé publique a peut-être une hypothèse pour expliquer cette situation. C'est-tu que nous sommes de bons citoyens modèles ou que les gens ne sont pas testés, ou est-ce que la ruralité nous aide dans ce cas-ci? Donc, je voudrais vous entendre là-dessus.
Je crois que le nombre de gens qui sont fait tester, c'est beau. Je ne crois pas qu'il y a des problèmes comme ça. Ça se peut que c'est juste, il n'y avait pas des gens qui ont voyagé dans les communautés, là. Alors, ça veut dire qu'il n'y avait pas quelqu'un qui l'a emmené avec eux. Et je sais que je crois que ces régions-là ont eu vraiment des beaux taux pour le nombre de tests qui ont été faits. Alors, je ne sais pas, c'est durant la même période, les régions 7, oui, il y avait environ 40 tests par jour entre le 7 décembre et le 7 janvier. Et je crois que la région 6 a eu le deuxième plus haut taux de dépistage dans la province. Alors, on voit que la seule autre région qui a eu un taux plus haut, c'était la région 4, mais je sais la région 5 aussi, il y a un beau nombre de tests qui sont faits là aussi. Alors, je ne sais pas, ça se peut que c'est parce que tout le monde fait exactement ce qu'ils devront faire. Alors, félicitations. Et s'il y a d'autres changements qu'on peut faire pour récompenser la population des zones 7 et des zones 5, sauf que le bravo, excellent travail.
Monsieur Caron, as-tu suivi?
Si, pour regarder ces...
L'organisation déroule en sécurité.
Merci, docteur. Merci, Monsieur Caron. Timothy Jakes, Campbellton Tribune.
Yeah, my question's for Dr. Russell. Vitality tells me the COVID-19 vaccines aren't mandatory for frontline health care staff in the province. Do you think that will pose any potential challenges to ensuring the safety of staff and public and ending the pandemic earlier?
I haven't had a conversation with Vitality specifically around that, so we may have to touch base with them to make sure that we're aligned and on the same page. But certainly, that would be their own workplace guidelines.
Do you have a follow-up, Mr. Jakes?
Well, yeah, I'm wondering if a lack of mandatory vaccines anywhere in the province would pose any potential challenges to ensuring the safety of staff and the public.
Well, the vaccine protects the person who's vaccinated from getting COVID-19. And in terms of, shedding the virus, if they were to get infected, again, if they're wearing their proper personal equipment, et cetera, personal protective equipment. Again, those are conversations that are going to happen with the regional authorities themselves. I don't see mandatory, for the public anyway, I don't see mandatory vaccination being something that we would put in place, but certainly there would be restrictions on certain types of activities that people will want to participate in potentially, but that would be at the discretion of the things like travel and airlines and things like that.
Thank you, Mr. Jakes. Bobby Jean McKinnon.
Yes, thank you. This is for either Dr. Russell or Minister Cardy. We know there are positive cases at 2 schools in Woodstock. Can you please explain why the 3rd school in the community is operating as normal when students there have siblings at the other schools and staff have children who attend the other 2 schools?
Well, all of the public health staff and teams over the weekend did an extensive amount of contact tracing. So all of the people that would have been asked to self-isolate after that 48-hour period was over would be people who had been a close contact of the cases. So if there was no close contact identified, then they didn't have to stay home. And sometimes for operational reasons, if there are too many staff or too many students that have to self-isolate, then that's why they would continue to not be in the classroom.
Ms. McKinnon, do you have a follow-up?
Yes, I do. Thank you. Minister Cardy, various schools have been emailing parents suggesting they plan ahead for homeschooling, which would occur at the red level, but Premier Higgs has said he doesn't believe the province will have to go to red, that orange will be sufficient. So why are the schools doing this, and is it at your direction?
Thanks for the question. No, we've had some districts and some schools have gone above and beyond in terms of taking precautions, which is totally fine. And the Premier was very clear as well. He said that if we have to, we would move to red, but we're doing everything we can to avoid that. And one of the things that's really marked our success throughout this has been everyone who can, using their position of authority, large or small, to do the right thing. And so when I hear that some schools are encouraging their teachers, encouraging their school community to take additional steps to make sure that students have got materials at home, that to me just seems sensible at a time when we don't know what the virus is going to throw at us tomorrow. None of us do. And it's that lack of clarity that makes extra planning extra important. So, de mon côté, la raison pourquoi quelques écoles ont décidé de demander aux élèves de peut-être porter le travail à la maison pour faire s'il y a un changement de phase, c'est juste les précautions assez raisonnables et c'est comme ça que la province a survécu la pandémie jusqu'à ce point. Les gens avec les positions de responsabilité, grandes, petites, ont décidé de faire tout qu'ils peuvent. Et en ce cas, ils ont décidé de faire, en vue d'un virus qui peut arriver dans une communauté ou dans une école demain, de prendre les précautions pour assurer la continuation de l'apprentissage, qui est le but central du système d'éducation.
Thank you, Minister. Thank you, Ms. McKinnon. Gilles Duval.
Oui, bonjour. Écoutez, on sait que dans la région d'Edmundston, il y a au moins 2 entreprises qui, depuis ce matin, fonctionnent au ralenti et ne permettent plus aux clients d'aller à l'intérieur de ces entreprises-là. Alors, on sait que quand c'est soit une école ou un foyer de soins ou n'importe quoi, on le dit qu'il y a un possible cas d'éclosion à l'intérieur. Est-ce que les entreprises doivent rapporter lorsqu'ils croient que la COVID-19 a peut-être fait son entrée à l'intérieur de l'entreprise? Est-ce qu'elles doivent, elles aussi, rapporter la situation?
D'habitude, s'il y a des gens qui peuvent être exposés au COVID-19 dans un endroit public, c'est la santé publique qui va faire les annonces. Alors, les gens qui doivent isoler à la maison, c'est la santé publique qui leur dirige vers leur auto-isolement. Il n'y a pas d'autre étape qu'une entreprise doit prendre, sauf que les informations que la santé publique fournit pour le public et la santé publique fournit pour les citoyens pour isoler à la maison s'ils sont des contacts étroits.
Monsieur Duval, as-tu suivi?
Oui, juste pour... donc, il y a une des 2 entreprises qui, clairement, sur sa page Facebook, a dit « Nous serons fermés pour 2 semaines » et l'autre a mis simplement un bout de papier dans la porte en disant « Fermeture reportée ». Alors, ils n'ont pas à aller plus loin pour vraiment faire savoir qu'est-ce qui s'est passé pour que les gens qui étaient là, peut-être, soient aux aguets ou...
La santé publique aurait fait ils auraient fait des enquêtes pour faire certaines qu'il n'y a pas d'autres gens qui ont été à risque pour le COVID-19. S'il y avait des gens qui étaient au risque pour le COVID-19, c'est la santé publique qui aurait dirigé ces gens-là de faire leur auto-isolement. Si ce n'était pas possible de leur contacter, ils auraient donné un avis public. Mais ça n'a pas été fait. Alors, s'il y a des raisons d'autres que ça, que les gens ont besoin de fermer, s'il n'y a pas assez de gens pour travailler, comme que ce soit, c'est vraiment la sécurité de les gens est assurée par les étapes et les protocoles de santé publique.
Monsieur Duval, Pascal Archinard.
Je vous remercie.
Merci.
Oui, bonjour. Ma question est pour la Dr. Russell. C'est un peu la même question que mon confrère Andrew a tantôt, mais en français. J'aimerais savoir pourquoi, selon vous, le Nouveau-Brunswick a tant de cas de COVID-19, alors que les autres provinces de l'Atlantique, elles, en ont moins.
Je crois qu'il y a quelqu'un qui n'est pas sur-muet. Oui, alors, qu'est-ce que j'avais dit à Andrew? Alors, comme j'ai dit à Andrew, je croyais que la raison qu'on avait une augmentation de cas approche de les fêtes et la veille de Noël, c'était il y avait plusieurs personnes qui voyageaient ici, en hors du Nouveau-Brunswick, et on savait que avant le temps des fêtes, il y avait environ 4 000 à 5 000 personnes qui étaient en auto-isolement à cause de voyager. Mais durant les fêtes, il y en avait environ 8 000 personnes qui étaient supposées de auto-isoler pendant les fêtes. Alors, s'il y avait des citoyens qui ne faisaient pas leur auto-isolement comme il faut, en toute sécurité, il y aurait des cas liés au voyage, certainement. Aussi, on avait planifié avec nos messages que durant les fêtes, on ne voulait pas que les gens se rassemblent avec plus de 20 personnes avec leur maison inclus. Et la raison pour ça, c'était que si durant les fêtes, c'était les mêmes 20, il n'y aura pas plus de 20 personnes sur la liste de contacts étroits s'il y a quelqu'un dans cette groupe de 20 avait un cas de COVID-19. Mais qu'est-ce qu'on a vu dans les fêtes, les temps des fêtes, on a vu des rassemblements où des gens ont participé avec des symptômes de COVID-19. Alors, c'est ça, c'était le risque qui était introduit dans ces rassemblements qu'on ne voulait pas voir, mais c'était le cas. Et aussi, il y avait des gens qui ont été à leur lieu de travail avec des symptômes aussi. Alors, si vous ne portez pas vos masques quand vous êtes au travail, il y a des gens qui ont des symptômes. C'est comme ça que le COVID peut se transmettre. Alors, je crois que c'est les deux situations qu'on a vues. Et aussi, en plus, il y avait des cas liés au voyage. Alors, c'est ça qu'on a vu dans la façon qu'on a vu la transmission de COVID-19.
Monsieur Rachnak, as-tu un suivi?
Oui, rapidement. Est-ce que la santé publique du Nouveau-Brunswick prévoit en ce moment des opérations de dépistage massif au Nouveau-Brunswick?
Non, pas à ce moment-ci. Les discussions que j'ai avec les équipes de médecins hygiénistes et aussi nos épidémiologues, quand on calcule le nombre de cas et la sorte de transmission qu'on voit, c'est vraiment tout lié. Alors, on ne voit pas la transmission communautaire à ce moment-ci. Si on était inquiète qu'il y avait des gens qu'on manquait, oui, certainement, on pourrait discuter. Mais à ce moment-ci, si tous les gens qui ont des symptômes peuvent se faire tester immédiatement, c'est ça qu'on encourage. Si les gens pourraient avoir le COVID-19, le app, ça aussi, ça nous aiderait aussi avec le traçage de contacts étroits. Alors, ça, c'est des choses qu'ils peuvent faire pour nous aider à ce moment-ci. Aussi, rester à la maison si vous avez des symptômes.
Merci, M. Rachnak.
Et juste pour ajouter, l'autre raison qu'on voit peut-être plus de cas ici au Brunswick, c'est parce que c'est nous qui avons les frontières avec Québec. Il y a beaucoup de personnes qui voyagent des autres parties du Canada à travers cette frontière-là, aussi la frontière avec Maine et les autres parties des États-Unis.
Merci, M. Rachnak. Mia Urquhart, CBC.
Thanks, Bruce. My question is for Dr. Russell. You mentioned that the COVID dashboard will soon include vaccination numbers and be updated weekly, but why not do what some other provinces are doing and update it daily, as you do with other statistics?
Well, have you ever watched a kettle boil? It takes a while. We are really getting a very small number of vaccines on a weekly basis, so it really wouldn't make sense for us to do it on a daily basis because our shipments only come in once a week at this point in time.
Follow up, Ms. Urquhart?
I do. This one is for Minister Cardy, please. You have asked parents to cancel or not book out of travel plans for March break. Given what Dr. Russell has said about avoiding all unnecessary travel, if people ignore your request and choose to travel, what repercussions will they face when they return?
We've been making it, thanks for the question, we've been making it increasingly clear that travel is the source, obviously, of COVID-19 into our province. And the more that we can hold it back, especially as cases rise around us, the better off we're going to be. Anyone who thinks it's a smart idea to go on a March break holiday in light of what Dr. Russell has said, in light of the evidence from around the world, is committing an act of selfishness against their family, against people in their community, and against the people in this province. They're draining healthcare resources from people who need it, and they're exposing themselves as people not worthy of the title of citizens. Pay attention to what public health is saying, because we want to try and keep people in this province as healthy and alive as possible during this pandemic. So in terms of specifics, I was pretty clear last year when we closed down the school system around March break that we had expectations for how people would behave upon their return. And that did not involve going to school. So the more that people decide to ignore public health, ignore the safety and well-being of the people they care for, the more there are going to be consequences. And no one wants to be in a position to be talking about this. We need to pay attention to the rules for the last few weeks so we can get through this, so we can go on holiday, so we can take off masks, so we can resume a normal life. But if we start pretending that we can do that before the pandemic's behind us, it's like hopping off a boat when you're still 500 meters from shore. You're going to get wet. Stay on board, follow the rules, and we'll get through this. En bref, il n'y a pas beaucoup de temps pour les gens qui décident que les règles ne sont pas pour eux. Les gens qui décident qu'ils vont prendre des vacances, qui décident qu'ils vont participer dans les manifestations anti-masques. Gens comme ça, il y a un niveau de narcissisme qui est démontré par ces gens que je trouve absolument déplorables et aussi dangereux parce qu'ils mettent en dommage la santé, mettent en risque la santé, le bien-être, les vies de nos Brunswickois et nos Brunswickoises. Alors j'espère que pour les prochaines semaines, les gens vont continuer de suivre les règles de santé publique pour qu'on puisse sortir de cette pandémie, commencer encore de prendre les vacances, d'être dans les larges groupes pour les cancers, etc. C'est ça qu'on veut. C'est pour ça qu'on a ces règles. Et je demande à tout le monde, pour les prochaines semaines, les prochains mois, s'il vous plaît, suivre les demandes de santé publique.
Thank you, Minister. Harry Forstall, CBC.
Thank you, Bruce. This is for Dr. Russell. Dr. Russell, you mentioned today at the end of your opening remarks the need for kindness and empathy. From the first day of this pandemic, your office has expressed concern for the mental health of New Brunswickers. So what's being done right now to assess that need and to address it? And how important is it, especially in this traditionally psychologically stressed post-holiday period?
Well, we've known from the very early days of the pandemic that mental health was going to be an issue. So we have information on our website that we provided very early on. We continue to try to re-emphasize that in terms of accessing services and help. And even before the Christmas holidays, we knew that that is a particularly bad time. Separate from the pandemic, on a yearly basis, we see an increase in needs for people with mental health issues. So as of right now, again, I don't see there being much change in what we've been doing in terms of our approach. I know it is a huge priority, and I know that, again, whatever resources we have, we are putting towards improving mental health services. That's some ongoing work that we've been doing. So I don't really have anything to add other than there are many resources available online to tap into.
Thank you. you, Doctor. Mr. Forstall, do you have a follow-up today?
Yes, just very quickly for Minister Cardy. Minister, what steps has your department taken to address the mental health needs of students, once again, in this particularly difficult period post-Christmas?
Thanks, Harry, for the question. So the first thing that we're doing to try and deal with the mental health crisis is by keeping schools open, which is why it's so important that everyone else contribute to that effort, so that we can make sure that our young people have got the chance to live as close to a normal life despite the restrictions that are in place. So since the school year began last September, we put in place additional supports for mental health, both centrally and at the school level, offering hotlines and numbers that students can call and access. We're making sure we're in much more regular contact than usual with folks involved in counseling and other tasks related to mental health in the schools, making sure teachers have additional information as well. And this is all part of a general effort, setting aside COVID-19, to try and make sure we deal with the mental health challenges that are becoming an ever-increasing problem across our school system. So I hope that gives a little bit of an answer to your question. But again, the biggest thing we can do for mental health right now is end this pandemic by following Dr. Russell's rules and making sure that we put this behind us. Pour juste brièvement en français, pour la santé mentale, on a les réseaux qu'on a mis en place commencement en septembre de l'année passée, une hotline pour les élèves, aussi il y a déjà les réseaux pour l'équipe professionnelle aussi. Mais aussi, je veux dire franchement que la chose qu'on peut faire la plus positive pour augmenter la qualité de la santé mentale des élèves et le reste de l'équipe scolaire est d'assurer que les écoles peuvent continuer de rester ouvertes. Et ça, c'est une manière que tout le monde dans la province peut participer dans le soutien du système scolaire. Alors, je demande tout le monde de penser à ça si tu penses que tu as besoin d'aller à Saint-Jean pour un peu de poulet. Merci.
Thank you, Minister.
Voilà la fin de notre mise à jour. Merci beaucoup tout le monde. That concludes today's update. Thank you very much.